Hey guys, I'm Dr. Megan Faulkner with Apex Sports Medicine, and in this video I'm going to show you how I use Ttool to do a rib mobilization. So what I first do is I'm actually going to just assess the patient's rib cage to see if I can find any ribs that aren't moving as well as they're supposed to. There should be a nice springy feel in the rib cage. So that's one way we can assess rib function. The other thing is you can also kind of feel along the ribs. And if you feel any one that's more prominent, it may have rolled upwards, and that's really common, a common issue that happens with our seated patients or our desk workers. The ribs will, especially ribs 1 through 6, will actually roll upwards, and so you may feel that it's a little more prominent. So I check to see if I find any prominent ribs. Also, if I can feel any ribs that don't move or are not as springy as the rest of them. So once I find one, which I did find one right here. So I'm gonna make note that I have a rib here, and I'm gonna actually grab the Ttool. I'm gonna grab the wide flat edge here, and I'm gonna use this really nice comfy rounded part to do the mobilization. It'll help me get really specific and save my fingertips. So I'm gonna come back and find that rib. I'm gonna place the Ttool on top of that, and then I'm gonna push down and almost inferior and hold that rib in place. Now the patient's going to take a nice deep breath in, and on the exhale, I'm going to provide a few mobilizations there. So once you get the rib moving and you can recheck to see if it's springy after that mobilization, then you've completed your treatment. So that's how I use Ttool to do rib mobilizations.